In today's lesson, we're going to be covering how to do trach care, so stay tuned. The first step in trach care is that you want to grab all your equipment. So one of the first things I want to gather is the inner cannula that I'll be replacing his inner cannula with, and making sure that it's the correct size and the correct type of inner cannula. So you can see we have an inner cannula here, the trach tube ties, suction catheters, a trach care kit. A good idea is to have also a spare trach, drain sponges, also sterile water. In some hospitals, depending on where you work, you may be using half and half mix of sterile water with peroxide, and some other hospitals you may be using just sterile water. And last but not least, some scissors or shears. Assuming I've performed hand hygiene already, put on gloves, my next step should be to introduce myself to the patient, identify the patient, and explain the procedure. A good idea is to wear a face mask with a face shield during procedures like this, as splashes may occur. However, for this video, I will not be wearing one for demonstration purposes. Hello, Mr. Kasmarek. My name is Daniel. I'm from Respiratory Therapy. I'm here to clean your trach tube. Go grab some equipment. I'll be right back. The next step is to auscultate and assess your patient. Mr. Kasmarek, I'm going to take a listen to your lungs here. So I hear rhonchi on my patient, so I determined that he does need some suctioning. This is a good idea to do prior to cleaning up the trach tube, as him coughing up the secretions afterwards can just basically ruin my job that I just did. It's a good idea to hyperoxygenate your patient. So we should be applying 100% oxygen on your patient and making sure to apply the trach collar back on in between suction passes. So I'm going to go ahead and suction the patient. I'm going to open up my sterile suction. When I grab my suction catheter, I want to make sure and grab it this way, so it makes it easier to keep this catheter sterile as I'm attaching it to suction. I should be assessing that I have appropriate suction pressure, and I'm going to go ahead and notify my patient that I'm going to go ahead and suction. I'm going to go in until I feel resistance or get a cough. At this point he starts coughing, I've met resistance. I pull back 2 centimeters, apply suction as I'm monitoring his oxygen saturations, heart rate, and blood pressure. I can twist on my way out. My max amount of time should be 15 seconds. As I come out, I should reassess the patient to see if he needs additional suctioning. I can roll the catheter into my sterile hand, replace the oxygen back on the patient so that he's resting and recuperating his oxygen saturations. I can feel with my left hand, which is now my non-sterile hand, I'm feeling for tactile fremitus to assess if he needs another pass. I have determined he does need another pass. I check back the oxygen saturations, heart rate, and blood pressure. Alright, my next step is going to be to set up a sterile field and to prepare all of my equipment. So in order to do that, I'm going to go ahead and open up my water bottle now and kind of just leave it loose, the cap loose. I can go ahead and grab my inner cannula, my new inner cannula here, and have it set up beside the patient. And I'm going to go ahead and open up my new trach care kit, which includes sterile gloves. Okay, so I will go ahead and apply the sterile gloves again. I can use this sterile sheet to drape the patient's chest. So I am right hand dominant, so I will go ahead and use my right hand as the sterile hand. At this point, I can go ahead and take off the trach collar and take out the inner cannula with my left hand, having the sterile inner cannula ready to go. Gonna take out your inner cannula here, sir. As I apply the new inner cannula, I can go ahead and start off on to the side and then rotate as I go in with the new inner cannula. Make sure it clips in as well. If I had a non-disposable inner cannula, I would have to clean it with half and half solution of peroxide and sterile water. Again, in some departments you may be using sterile water only, in which case you would go ahead and dip your inner cannula in the solution, having sterile gloves on, and go ahead and use this brush that may come in your Trach Care kit. As you're using this brush, you need to make sure that you are pointing the trach tube away from yourself as you come out with the brush, because you may get splashed. After we finish brushing the inner cannula, we can grab the sterile water once again and rinse out the inner cannula and leave it to dry. Okay, so our next step will be to go ahead and remove the old drain sponge. Now, I'm still maintaining my right hand sterile. I'm going to go ahead and with my left hand open up the sterile water, pour it into one of the compartments. So in the other one of the compartments, I do have some gauzes and some drain sponges in there. I will use one of those drain sponges. Fold it up and dip it into my solution. This next part, I'm going to wipe the patient's skin first in a motion where I'm starting at the stoma and wiping out and working my way around. Once I have cleaned the skin side, I can move on to the flange. The next step is going to be the detail work. So this is where you use your Q-tips. I can dip it in my solution as well and get underneath the flange. And I'm still doing the same motion, working from the stoma out, and just working my way around. My next step, once everything is clean, I can now pat the skin dry, followed by the flange. Alright, so my next step is going to be to apply a new drain sponge. To best accomplish this, one trick I like to do is put one finger underneath the trach tie, pull it towards me, and I'm going to go ahead and use my other finger to stick the drain sponge underneath. Once I do that, I can now grab both plies of the drain sponge, bring the drain sponge up, and repeat the same step on the other side. Keep in mind when you are going to be so close to the trach tube, as you're moving the patient's trach tube, this is causing a irritation inside of the patient's trachea, which may trigger a cough. So be aware of that. If you do have your face shield, of course you're more safe, but don't be afraid to use your hand if you do not have your face shield to kind of block the sputum from being splashed on you. Okay, so my next step is going to be to replace the trach tie. Very important, as soon as the Velcro strap comes off, the trach tube is not secured, so I need to make sure to secure it with my hand at all times. So my next step is I'm going to go ahead and put this underneath and feed it into the flange. Now this could be challenging as well. One trick I was shown is to make a crease into the trach tie and fold it up a little bit. So this can now be fed in a little bit easier.
And there it is. One tip to help us get the rest of the tie to the other side of the patient's neck is to attach a part of the new Velcro strap to the old one so that we can now pull it through, help us pull it through to that other side. Now we can go ahead and release the other side of the old trach tie. And now attach the other side of our new tie. Again, you can make that crease into the Velcro strap so that it facilitates the insertion.
In some cases I may need to cut the extra slack that I have here, and that's what I have my shears for. Anytime you're using shears, scissors around a pilot balloon, you want to be extra careful that you're not cutting the pilot balloon. So if I have excess here, I will go ahead and cut this. Another thing we need to do is reassess our patient. We've got good oxygen saturation, so good heart rate and blood pressure. Auscultation of the patient. Our last step is to go ahead and clean up.